Today we're going to talk about our Foundations Ortho program. I consider this to be kind of the starting place for most of the kids that come into my office that are going through orthodontic treatment or who need intervention. The reason why Foundations is so important is because it's really going to set kids up for long-term stability so that any type of orthodontic treatment that's done is going to last longer and it's going to be stable. We have a horrible problem in orthodontics where a lot of the times we'll do all of this braces, we'll straighten the teeth, and then just a couple of years later, we will have relapse. And that's really happening because we are not taking the time to really focus on the why behind the problem in the first place. So stay tuned. If you have kids that are between the ages of 0 and 18, you want to listen to this podcast. If you yourself have crowded teeth or you think that you might need some type of orthodontic intervention, this is another great podcast. It's also great if you've come into our office and you're a patient and we've recommended the foundation phase. It's going to give you so much more insight. So make sure you stay tuned. Welcome back to another episode of Your Mouth Matters. I'm Dr. Rebecca Taylor, owner of Green City Dental, Biological and Holistic Dental Office in Edmonds, Washington, and Orthodontics, a practice that focuses on TMJ, airway, and functional orthodontics. All right, today we are talking about one of my favorite topics, and which is basically how we grow kids' faces so that they grow properly. That's going to support a proper airway. Today, I have Lily Corley with me because she's very instrumental in what we call our Foundations Orthodontic phase. So welcome, Lily.
Well, thank you. It's great to be here.
Thanks for taking the time. Okay, so today, this is for like all the parents that we recommend Foundations Ortho to. Most people are like, what is that? So we're going to talk about it today. If you're listening and you have a child that you think needs orthodontic intervention, you should definitely keep listening to this because we're going to talk a little bit more about how to create long-term stability and make whatever type of treatment that you do last longer. And that's going to make your money go farther. And it's also going to make the changes in the treatments that you do have more of a lasting health effect on your children. Okay, so let's get into it. So we really have a problem in the traditional orthodontic world because we see that about 90% of orthodontic treatments relapse. When it comes to jaw surgeries and all of that, it's an even higher relapse rate. So we are so focused on straightening teeth, which orthodontists, by the way, are amazing at. You know, they've gone to school. That's what they do. But what they don't do is they don't really look at the root cause as to why the crowding happened in the first place. Why does this kid have a bite issue? Why does this kid have crowding in the teeth? And so when we step back and we look at why, we find that the reason why our faces don't grow and develop properly is because the breathing is not through the nose and the tongue is not up in the palate. So there are certain things that are going to help stimulate proper growth and development. And if you don't have these, if your kid is not doing these, there's no way that your orthodontic treatment is going to last long term. Okay. So the first thing is that lips have to be together.
Yeah. You got to think of the lips as the braces for your teeth as you develop.
If the lips are open, then the cheek muscles are pushing in. And if the tongue is down, so that's the other thing, the tongue has got to be up. That's the second one. If the tongue is not up, then the cheek muscles are going to push in, and that's going to cause the palate to collapse, and that's going to make it so that there's not enough room for the teeth, okay? Your teeth are going to come in. They're not going to come in because there's not space, okay? So we see teeth that get stuck. We see that surgery has to be had. We have to go up and find teeth and pull them down. Then those teeth might need root canals. Like there are so many aggressive interventions that are needed when we don't have proper growth and development. Sometimes it's like we need jaw surgery. We have to, cut your jaw and move everything forward. And again, like I said, all of that stuff is going to relapse if we don't really address this foundational functionality.
Well, if you think about it, how many people have had their wisdom teeth removed, right? It's standard now to remove your wisdom teeth. However, that's not the epigenetic idea around your wisdom teeth. They should be there in your mouth.
I'd say it's not the genetic way, right? Even take epigenetics, like whatever. But genetically, we should have 32 teeth that fit in our head.
Yeah.
Epigenetics is what makes us not have the room for 32 teeth in our head, right? Because environmental factors are getting involved, which cause us to do mouth breathing, which cause us to have our lips open. And all of that affects the way that our mouth develops. And so we see these epigenetic changes from these environmental factors that are changing the way that our teeth come in, and then we have no space for wisdom teeth. And we don't have space for wisdom teeth because the maxilla didn't grow forward enough. You know, when our face grows, it grows up and back, but it grows from the back of the mouth. So it's very interesting. They did a study in pigs and piglets where they put a little BB in the very back of the pig's palate, little baby pig, and they took x-rays of the BB, and they found that BB moved forward. So the bone, when your face is growing during those growth and development years, the bone is actually being put down in the back of the mouth, but what that does is it pushes the bone forward.
So you're growing your maxilla forward.
Well, it's technically your growth is happening in the back. So the growth is actually happening in the back of the mouth, but it's repositioning the bone forward. Okay. So it appears like it's forward growth, right? So we always say like forward growth. But if you want to get really technical and you want to study skulls and look at all the studies and get super dorky, which I know some dentists would critique and be like, oh, that's not growth, right? Growth is happening this way. So I gotta make it accurate here. But basically it appears that, so the bone is actually, it's not growing forward, it's repositioning forward.
Okay.
And what happens is when we grow forward, not grow forward. When we're repositioning forward, we also are getting widening at the same time. Okay. That's the way that the jaw grows and develops genetically, naturally. If the tongue is up in the palate, the lips are closed, the breathing is happening through the nose, and if our swallow is correct.
Right.
Okay.
Yeah.
So if those things are all there, we're going to see that kids have spaces between their teeth. We're going to see that their airways are going to develop properly. If we see that there are alterations in this, that's when we start to see crowded teeth. We see palates that are narrow. A narrow palate is actually a sign that we didn't get that proper remodeling forward. We didn't get the proper growth that happens. Okay? So a lot of dentists are so obsessed with widening the palate. It needs to be wider. There's even like surgical procedures where they screw into the palate and they like break the suture open and they're widening. The problem is that we are still missing how we actually grow. We don't grow that way. We grow in a way that allows our maxilla to reposition forward and widen.
Yeah.
Right? So forward and widen at the same time.
I think it's bringing it back to the foundations. It's so critical to do this early on. It is way harder to fix any of these issues after the growth of the face.
Most of the growth in a child happens by age 5. Mm-hmm. Most of it does. And very few people bring their kids to me before age 5. Most of the time, parents bring their kids in when adult teeth come in and they're super crowded. Mm-hmm. By age 9, the maxilla, the top jaw, is almost adult size. Mm-hmm. The tongue is almost adult size. You've pretty much gone through like 90% of your growth by the age of 9. So catching this early is ideal. Now, I know a lot of you are probably listening to this going, oh my gosh, my kid's 10. I have a 15-year-old.
Right.
Okay, so that doesn't mean that we can't do anything. Okay, I mean, I can do work in adults too. It just makes the treatment longer. It makes it harder. And there could be some compromises, right? Because we're trying to catch you up to that growth. And it's kind of like if you stopped growing when you were age 5, height-wise, like now you're 12 but you're still the same height as a 5-year-old. How do we catch you up so much? Like we might not be able to. You're probably going to just be short, right? Like we can probably get some, but probably not all of it to reach your full genetic potential. So that's why catching kids when they're in that active growth phase is so important. And that's also why at Orthodontics, we have almost every kid go through our Foundations Ortho stage. And that is something that we do before any appliance therapy. If we have to do appliance therapy first because maybe there's a tooth that's stuck or something, then we might do the foundations phase afterwards. Mm-hmm. But if you don't do foundations, you are not going to have that long-term stability. And things are going to go back. They're going to go back to how they were. Because the way that we grow and the functionality is really what creates the structure.
So with foundations, what does that look like? How does that begin?
So the first thing that we do with foundations is we assess your child. We take a scan of their mouth. We have you fill out a questionnaire. We have you observe them. And then we determine, we come up with a treatment plan, basically to treat them. Sometimes we know right off the bat that this kid is going to need an appliance, and that an appliance therapy is going to be needed. But most of the time we don't start there. We start with foundations. Foundations is all about getting the lips together, breathing through the nose, getting your tongue up, and having you swallow the right way. That's what foundations is about. So every kid is different. Mm-hmm. Some kids they're already doing most of these things 90% of the time. We don't have to work with them that much on it, right? They fly through foundations. Mm-hmm. We get them into the next phase. Those kids a lot of the time might not even need an appliance therapy because they don't have much of a foundational issue, right? Other kids might get into foundations and we just cannot get them to get their lips together, or we cannot get them to breathe through their nose. It's like, it's not possible. Mm-hmm. Okay, so our foundations phase runs about 4 months. In that 4 months, that is a trial period where we are trying to get that function established. If we can't get the function established in 4 months, we know there's something bigger going on, and we've got to dig deeper.
What would you say is one of the main things that we see with the kids that would, be a red flag, or we would, need to send them to the ENT?
So we always start in foundations, we always are starting on breathing exercises. That's the first thing, because foundationally, we have to teach kids how to breathe right. Mm-hmm. A lot of kids, a lot of people aren't breathing through their nose, and they're not using their diaphragm to breathe. So we start them off on breathing exercises. We do oralays, which we have another podcast on oralays, but Lily actually does the oralays treatment. Oralays is all about releasing fascial restrictions under the tongue and in the mouth. That it helps to increase the range of motion of the tongue. It helps you get your tongue up into the palate. It also helps us identify if an actual tongue tie release is needed. Mm-hmm. So a lot of times kids may have a very tight tongue, so they can't get their tongue up in the palate, but that could be because there's just a fascial restriction. So we do oralays. The oralays treatment will release the fascia, and it will also help us determine, if we do oralays and we still don't see that tongue coming up, and we still don't see that range of motion, then we probably need to consider a surgical release. I never really want to just jump into a surgical release unless we've gone through the steps of oralays. And if you are interested in learning more about oralays, we have another podcast on oralays. There's also information on our website. So through the foundation phase, we're doing oralays treatment. We are doing exercises. So there's home stuff that you have to do. And then you also are going to be given a myobrace appliance. And a myobrace appliance is a silicone appliance. It is not custom, so there's different sizes. So we size you for what size is appropriate. And the myobrace appliance is a tool to help remind you where your tongue goes. And it's something that you wear every night. And then you also wear it 1 to 2 hours a day. Okay? And the concept with myobrace is that it's a big, bulky appliance. It's kind of uncomfortable. It's not super fun.
What I've noticed with it is that it's a great tool for getting that tongue up, because it is super uncomfortable until your tongue is up on the roof of the mouth there's a little tongue tag, and that helps alleviate so much of the discomfort.
Yes.
So
if you're wearing the myobrace the right way, it's quite fine. If you're not wearing it the right way, it falls out. It's uncomfortable. You don't like it. You can't put your lips around it. So if there's a tongue tie that we're dealing with, the myobrace is a really great way to kind of see all right, what kind of kid are we working with here? Are we going to have to do more, or are we good? A lot of kids will wear the myobrace, and if you're mouth breathing, that myobrace at nighttime is going to fall out. Yep. Every night you're going to be like, it fell out, it fell out, it fell out. What does that tell us? Well, it tells us that we still have a dysfunctional problem, right? Yep. So to get through foundations, we're basically testing your child to see how aggressive do we need to be. Maybe the tonsils need to come out. Mm-hmm. Maybe the adenoids need to come out. maybe we need to look at potentially there being mold in your house, or we need to look into some gut testing to see if maybe you have a food sensitivity. There are different reasons why kids are stuffy. There's different reasons why kids can't breathe through their nose, right?
Absolutely.
Sometimes it's just a habit. So if it's a habit, we have to train that habit out of them. But if it's not a habit, we have to know that there's an actual physical obstruction, and then we have to be more aggressive. So Foundations is a program we put all of our kids through. It's 4 months long. And during that time, we're checking in and we're seeing, okay, how are you progressing? Can you go to the next step? How are you progressing? And at the end of Foundations, we decide, all right, can you graduate to the next thing? Now, some kids, like I said, they fly through it. It's easy, and they go on to the next phase. Maybe they don't even need more than that. They just need to wear a myo brace. But other kids are going to struggle. And these kids are the ones that need it the most.
Yeah. And actually, that's the best, actually, for that we're finding this out for these kids, and we can help get the support that they need.
And we're doing it early.
Yeah.
A lot of dentists will just throw appliances in, do all of this expansion, and then the appliances come out and they're like, okay, like you need myofunctional therapy, bye. And then maybe the patient doesn't follow through in that. Maybe, life gets busy and you're like, well, they have a nice big wide smile now. Like, I don't think they need this. Do we really have to spend more money? Well, but the problem, and I've seen this in my own practice, just last week I had a patient that this is exactly what happened. I didn't do Foundations because we didn't have that program yet. We did expansion, all this beautiful room for everything, and then comes back 2-3 years later and is crowded again. And I gave them a myo brace and I told them to do myofunctional therapy and they didn't follow through with it, right? And so you're like, okay, well, back to the drawing board. We got to do this again, right? But it's frustrating. It's frustrating for parents. It's frustrating for kids when they're like, I just did all this treatment and it went back.
Absolutely. I mean, I think that it sort of is like pushing the boulder up the hill and then it falls back on you again. You're just a little bit defeated in that moment,
Yeah.
So, and I think that the importance of breathing, we take it for granted almost how important breathing is. We do it every day, all day long, all night long. I think, it's at the same time, if we are breathing dysfunctionally, we're not necessarily pointing it out in one another. We're not necessarily getting that feedback. We don't have, a screening, like a pediatric screening for breathing like we do for hearing and we do for vision. But like breathing is at the core of our existence, and dysfunctional breathing, once you have that going on, it's really hard to change without an intervention. You need to make a concerted effort to change your breathing. And I think singers get that and swimmers get that. And, there are wonderful breathing teachers out there, Butanko breathing and, restorative breathing. Everybody knows about Wim Hof. He's doing all this like breath holds and ice baths and things. And, it's happening. But for me, it's like, man, like these kids, like if we can just intervene at this stage, like we're setting them up for the rest of their lives, to breathe right for life, and I think that.
And it's crazy. I mean, I saw a statistic that 50% of our 4-year-olds are mouth breathing.
Yeah.
It's become kind of the new normal.
Oh.
It's not, I'd say it's common, but it's not normal.
Yeah.
Right? But parents, nobody teaches you that you should breathe through your nose. I mean, I never learned that.
Or even if we kind of get it and we see it, we're not really sure what to do about it as parents, And so I think this is a great tool for parents, and it's nice to have help and guidance from our dental office, from Orthodontics, because as a parent, you're doing so much for your child. It's hard to do everything that they need without support from other professionals and people who care.
Yeah. Absolutely. So we do find that, sometimes with kids, like we just cannot get them breathing through their nose. They might have really big tonsils. They might have really inflamed adenoids. And I know that there's no parent wants your child to go through an invasive surgery, right? I mean, nobody wants their kid to have their tonsils out or their adenoids removed. At Green Sea Dental, we have a lot of holistic patients, and they are very against, any kind of surgery. But here's the thing. If your child cannot breathe through their nose, if they have an airway like sleep disorder breathing, if they have an airway issue that maybe is undiagnosed, I would say if a kid is mouth breathing, it's almost guaranteed that they've got some issue, sleep disorder breathing issue. If your child has a sleep disorder breathing issue, then that is actually impacting the way that their brain is growing. It's affecting the way that their hormones are produced. Their growth hormone is produced at nighttime, right? There are all sorts of other health issues that are linked back to these things. And when you have a growing child where there are all these neuron connections happening, I mean, thousands of neuron connections happening every minute, it is such a critical time. It's such a critical time. And if you wait to treat, like a lot of pediatricians will be like, oh, they'll grow out of their tonsils. Don't worry. They'll get smaller with time. The thing is that you don't have time. The time is now. Most of that growth on the face is going to happen by age 5. And if you don't become aggressive in your treatment, you're missing the bus. Like you're missing this huge window of opportunity. So while I'm not like super excited about removing all the tonsils if they're a little bit big, we talked about in our Oral A's podcast, we talked about how sometimes tonsils are enlarged, not because they're actually big, but because the muscles, the pharyngeal muscles, are sagging into the airway. So if we can stimulate those muscles, get those muscles, working the right way, sometimes the tonsils don't need to come out. Their other thing is that if your child has big tonsils, why do they have big tonsils?
Right.
Why?
Right. Like the root cause matters. Like, so if it's, a sensitivity to dairy, right? And you cut out dairy and they get smaller, well, that's a really, straightforward thing. But let's say it's an allergen to some kind of dander or mold you can't see in your home and you don't even know it's there. Like there's other immune responses because like tonsils are lymph, right?
Yep.
So they're responding to inflammation. And there is a difference between a healthy tonsil that can recover and one that is cryptic.
Yeah. So tonsils, it's normal for them to get enlarged when you are dealing with an acute infection. So if your child gets sick and you're like, oh, those tonsils are really big, that's normal. If they're red and they're puffy, that's normal. If a tonsil is chronically inflamed over time, whatever reason that is, maybe they have a dairy sensitivity and you've been giving them milk their entire life. And now they're 10 years old and they've been eating dairy the whole time. That chronic inflammation is what causes that tonsil to shut down and turn cryptic. Okay, so if you look at the back of the tonsils and they're not really bright red and they have little crypts in them, maybe there's tonsil stones. If that's what the tonsils look like, they're not functioning. They're not actually doing what they should be doing, which is draining the lymphatics. So to me, you got to remove them. You have to remove them. The same with the adenoids. If those adenoids are so enlarged, obviously go figure out the why. Have your house tested for mold. Have your child tested for sensitivities. Get a cover on your mattress, like a cover that will, for dust mites, right? An allergy protected mattress. Wash your sheets. Get an air filter. Do all of these things. But if you don't see dramatic improvements in our foundations phase, which is 4 months long, if we don't see dramatic improvements with what you're doing at home, what we're recommending, then I'm going to be recommending that you go have a surgical intervention. And the reason is because it is so important that we have proper growth and development of the face and that we have long-term stability for the airway.
Yep. And so the thing is, if we see after 4 months you are not breathing through your nose, that's going to be the next step for the patient before an appliance, right?
Yes.
Because we're not wanting to go through that whole process, the costs and everything, if you can't breathe through your nose.
And here's the thing. Some parents are like, well, can you just do the appliance because, I read somewhere that if you widen the palate, then that helps open up the airway. And there is some truth to that. There was a study done that after expansion, it opens up the nasal passages or the sinuses by like 30%. So yes, you are going to get some changes in the nose. But in my experience, working with a lot of kids with a lot of breathing issues, when I see really big cryptic tonsils and I see adenoids that are huge and I see that a kid cannot breathe, I see that their nose is up tilted, bags under the eyes, all of that, I've never seen a kid like that who completely came around and normalized. Those kids really do need some kind of surgical intervention because their bodies have been fighting for so long and their bodies are in such distress that it is hard to undo that, right? It's kind of like the point of no return. Now, if you address this in a child right away, if you're like, oh, my 2-year-old is snoring, my 2-year-old's got a thing, and you nip that in the bud right away, then that's great. But a lot of times the why behind why the tonsils are enlarged, the why behind the adenoids is so much bigger than just like cutting out dairy. It might be like there's mold in your house and now there's like this whole thing, right? You have like, you're just living in this mold and it's very hard to get rid of it. And then you have to detox and it takes years to detox, right? And we don't have years when we're dealing with kids. The other thing is that a lot of people feel like the tonsils are there for a reason, and they are. They're supposed to be functioning part of the lymphatic system, draining the head. We call them the toilet bowl of the head. Everything gets flushed to the tonsils, and the tonsils have to flush everything out. If they're not working because they're cryptic and inflamed, then they're not doing their job anyways. So take them out. The other thing is that a lot of the ENTs are not removing all of the tonsil. Right. They're just removing the part that's granulated, that's cryptic, that's not functioning. So the techniques surgically have actually changed. In fact, some people's tonsils actually grow back because maybe they're still living in a moldy house or maybe they still have a cat allergy or something and they didn't get rid of the cat. But those, the tonsils will actually grow back. So yes, address the why, but please don't wait too long. It's really important. So the foundations phase is about, can we get these kids functioning properly? When we get done, maybe they need a tongue tie release. If the myobrace is falling out or uncomfortable, that might be a sign that there really is a true tongue tie. Maybe they need a lip tie release because the lip tie can affect the tightness in the lip, and that can also impact the forward repositioning of the maxilla. So we want to make sure that any structural thing is addressed during this time, because then when we move into appliance therapy phase, it's going to just go a lot smoother. And then you're going to have, like I said, that long-term stability.
So once we've addressed the structural issues, which include breathing, nasal breathing, we're looking at tongue function, we're making sure that there's not structural restrictions with the lip tie and tongue tie, we graduate on from foundations. So what happens next after foundations?
So if you've gone through our whole foundations phase, you've done the exercises, you're just like, you're passing, we make basically, our guidelines are you've got to be able to wear the myobrace for 30 days straight without it falling out, without tape. So in the beginning, we might say, okay, let's do tape. Let's do this. We're going to give you exercises. And in the beginning, it's probably going to fall out. Even in a kid that's functioning the right way.
Normal.
It's very normal for it to fall out. So a lot of parents call us, they're like, it's falling out. Where, this is so hard. And it's like, it's okay.
Yep.
Breathe. That's normal. That's normal. It's uncomfortable. Yep. That's normal. That's all normal. This is so diagnostic. It's just, but we got to get you in this program, right? We got to get through it. And so once we have established the proper breathing, the proper tongue position, all that, then we evaluate to see if we need an appliance. And like I said in the beginning, a lot of the time we're deficient in that forward reposition, that forward growth. So we need to use an appliance that is going to address the proper AP position, the proper forward growth, and stimulate our jaw to remodel in a way that's naturally how we grow. Okay? If you just are widening and you're not going forward, you're missing how the maxilla naturally grows.
So what's the difference between that appliance and what they're doing in standard ortho?
Well, a lot of times in standard ortho, they're not doing any appliance. A lot of times in standard ortho, they're just putting braces on. And if they don't have enough space, they're extracting teeth. That does happen still. If they're in standard ortho, they might be doing a widening appliance that just is widening, side to side widening. But that, again, is not really addressing that forward growth. And a lot of times, if they're, there's a lot of dentists that are doing like MARPI, which is like that surgical procedure where they're actually splitting the suture. And while that can really be great for the nasal breathing, it kind of forces the nose open, I'm a little hesitant about that because it doesn't really follow the way we naturally grow and develop. And there's not really a lot of long-term studies on it. So and there can be there's been some really, I've just seen a lot of patients that have had a lot of complications from that. And so I just always think like, well, how does the body grow foundationally? What are the things that we need to do so that we can set kids up for long-term success? Because we really want to just help them along. We want to catch them up and then help them along. A lot of kids are, maybe 7, 8 years old, and we do all of this work, and then they still go through puberty, right? So they're going to grow again. Mm-hmm. They're not done growing. Everybody always is like, well, when are we going to be done? And you're like, that is a great question. Let's just talk about that for a second. So the last teeth that come in are wisdom teeth, and they usually come in around age 21. Mm. So we're growing up until our early 20s. And so, truly, you're never done with orthodontics. Patients come in all the time that are like 50, and they're like, my teeth are so crowded. They used to not be like that. That's because your bite is shifting. That's because your teeth are always moving. We're never really truly done with orthodontics and teeth movement,
That's
right?
a very different concept,
right?
It
is.
And I think that for parents, I think it's become very standard to go get your kid braces when it's time to get braces. And they think that's like a 2-year process. Mm-hmm. But because it sounds like what you're saying is that we're actually dealing with growth the whole time that they're growing, monitoring and making sure that at each step along the way, they have the foundation that they need to grow properly.
Yes, and that kids know where their tongue goes. And they know that they should breathe through their nose. Because let's say that you end up getting a really bad sinus infection. Let's say that you're 25 years old and you just moved into a new apartment and there happens to be a water leak and there's mold in your house. And now you develop a really crazy sinus infection.
That happened to me.
I'm looking at you. I'm literally telling Lily's story, but
exactly what happened.
But You know what? What happens now? You're breathing through your mouth. You're 25. You're pretty much done growing, but your teeth are going to move because your tongue is what holds everything together, and your breathing is what holds everything together. So we're teaching kids at a young age what is proper function, because when they get derailed, because trust me, there's going to be things that happen. You're going to get sick. You're going to have a mold exposure. You're going to, there's going to be some, we live our life, right? There's things that happen to us. And so we have to know like what is normal, because if our normal is proper function, then when we're out of that function, mm-hmm. we're like, something is wrong here. I need to get back to my normal. I need to fix this. Right?
The baseline.
But if you are never taught how to do it right in the first place, like a lot of adults that we see that have sleep apnea and TMJ issues, they never were taught this. They never have breathed through their nose in their whole life, Well, and it's so much harder because it's so foreign to them. They're like,
hard.
What do you mean my tongue
60?
Yeah, like what do you mean my tongue goes up? And now you're 60, and they're like, well, I'm not progressing as fast as I want to. And you're like, yeah, that's because 60 years you've been doing this wrong. And now I have to undo all this. This is not going to happen in a day.
Well, how do we help these kids learn how to breathe properly? Like what part of the foundations do you think really is critical, as well as the myobrace appliance and, the oralaise is part of it?
Yeah, oralaise is really important. It's all really important. The myobrace is a really important tool. The exercises are a very important tool. And then also, if there is a physical obstruction like tonsils or adenoids or a tongue tie or restriction, we have to get rid of that. You have to get those things out of the way. It's kind of like a roadblock. You're trying to drive and then there's like a tree across the road. Well, you're definitely not going to get to the other side. You have to remove the tree, right? So removing any of those things, which we address in all of the foundations. So I'm very proud of the foundations program. I feel like it's taken me years. I mean, I've been in practice 11 years. It's taken me 11 years to figure all of this out and really come together with this very comprehensive program. And I think it's very unique to our office, and it just makes so much sense. But it also allows it so that kids are not falling through the cracks, because too many kids jump into the appliance. They get into the appliance world. They go see an airway orthodontist or an airway dentist, and all they want to do is sell them an appliance. And they're not, and they mention myofunctional therapy. They mention the tongue, but they're not really making sure that there's follow through in that, right? And I think that's what's so unique about our program.
Yeah, I think the compliance is critical. One of the things that with myobrace, there comes activities, and we use an activities app, and we really focus on the breathing in the beginning, and it's something that kids have to do at home every day. And for some families, that can be a challenge. So we really coach them to find ways to incorporate that into their day. And the app is great. You can have the kids use a tablet or a phone.
It's super kid-friendly.
Very kid-friendly.
Most kids are like, ooh, I get some screen time. And you're like, yes, you do.
Approved screen time.
Approved screen time, yeah.
Yeah. And so, I think that's the thing to know about this. It's not just an appliance that gets fitted into your mouth and you just go off. The kids and the families have to find commitment to the program,
Absolutely. There has to be buy-in, right? There is no magical appliance that you put into somebody's mouth. Now, if your only goal is straight teeth and aesthetics, well, not even aesthetics, because I would argue that a properly developed face is much more aesthetic than a non-properly formed face, right? Like everybody's getting fillers these days, like on the cheeks. And that is so common because 90% of people are deficient in that forward growth of the maxilla.
Which affects your zygomatic arch.
Which affects your cheekbones and the support of the soft tissue, so you end up getting wrinkles under the face. I always explain this to kids. A lot of times teenagers will come in and they're just very focused on their looks and aesthetics and, oh, am I going to look weird? And I'm like, you are going to be so glad when you are 35, you're going to be so glad that you did this because everybody else is going to have a deficient face and you aren't going to need the fillers.
There was actually one teenager who was in MyoBrace who kind of wasn't so into it and, had to wear it regularly, but was kind of not into it. And then saw, after doing it for a couple of weeks regularly, that her teeth started to change. And she got so excited to see that her teeth could normalize for her, you know. And then she found that commitment, because it is a commitment. It's a commitment to wear the MyoBrace every night when you go to bed, during the day for at least an hour, and then to do your breathing exercises every day, which feel really good, but sometimes we're very busy and
it really is a therapy. And it really, like I said before, we're still growing even into our early 20s. So orthodontics is really never over, right? I mean, we can put out the fire, we can catch up the growth, we can do as much as we can straighten the teeth, but we can't control everything that happens in our life. And because we address this from such a functional position, it takes longer. It takes longer because we're having to undo years of improper growth, which is very hard to do. The longer you wait, the harder it gets. So that's really important to remember as a parent. And it's important for your kids to understand that too. I don't give people timelines, right? It's well, how long is this going to take? Well, I don't know. I mean, I can give you kind of a ballpark, but it so depends. It so depends on the function and the stability of the case, and life can change, right? So I just don't know, and I just want people to think in their heads, you have to start thinking about orthodontics differently. It's not about straight teeth. This is about catching kids up to their proper growth, getting them to their full genetic potential. Genetically, we should have big, beautiful smiles. We should have room for 32 teeth. Our maxillas should be nice and forward. We should have nicely formed airways. So we have to start thinking differently about orthodontics, because when we get so obsessed with the straight teeth, that to me, the straight teeth is a byproduct of this proper function. But you've got to lay that foundation first. And sometimes laying that foundation, it takes a while. It takes a while to do. The other thing I want to mention about traditional braces is that most braces are going to actually retrude the maxilla. They're going to pull everything back. Even Invisalign, some studies show that it can pull that maxilla back up to 4 millimeters, which is quite a lot. So traditional braces is actually, in some ways, you could argue, is making the problem worse because you're actually pulling everything back. And so you have to make sure if you need braces, that you're going to a dentist that's doing controlled arch braces, which is where they put stops on the back teeth and they're pulling things forward. Okay? Because the traditional orthodontics is going to pull everything backwards, which is doing the opposite of what we want to do to help create a healthy airway.
Yeah.
Okay. So it's not just about remodeling that maxilla, repositioning it forward, widening, making space for the tongue. It's also about when you get ready to do your braces, doing it the right way.
And I think it's something important to address is that you can go through the foundations, you can go through, potentially an appliance afterwards if that's, what gets treatment planned. And you might still need braces afterwards. There's no guarantee.
A lot of kids are going to still need braces if you don't catch them in that very early stage. So like I said, most of that growth is happening before age 5. And then by age 9, you're almost completely adult size in terms of the mouth. And so if we really want to try to avoid braces, I can't guarantee that on anybody. But if I was going to bet money on who I don't have to do braces on, it's going to be the little guys. And so getting them in as early as possible. And if you notice that your baby or your child is got their mouth open, they're breathing through their mouth, they're snoring, you need to address that right away. And for babies, we have to really focus on proper nasal hygiene and making sure their sleeping space is clean. You got to make sure that their sleeping space is clean and that you're practicing proper nasal hygiene. Get them used to clearing out their nose. That's so foundational. And so many parents, they've never heard of this. They don't know. And this is a whole topic for another podcast, like what do we do with babies? So I'm not going to go too much into it. But the moral of the story is that the earlier that you start, the more likely you're going to be to probably not need braces. But even if you do all of these things, you might still need braces. So I don't want anybody to feel like, I did all this stuff. And because what we're doing again, it's not about straight teeth. Braces is about straight teeth. This is about proper function.
And then I think, there's a couple of things too that are different from orthodontics as one that we're starting earlier. Often in traditional ortho, they might check you early around 7 or 8, but they're just watching.
Most of them don't really, some of them are treating a little bit more early now, but most of them are not using the proper appliances to promote proper forward growth. And then a lot of them just want to wait until the kids are older. They have all their adult teeth, which is by that time, that's like 9, 10, 11, 12. So by that time, you have completely gone through most of your growth, and the intervention that you do is going to be more minimal. So it's really, I cannot emphasize how important it is to treat early. And I just wish I had braces twice. I still have problems. I wish that my parents would have treated me early. Even if you don't do the braces part, at least do the foundations part, at least lay that foundation. If you want them to pay for braces when they're 17, 18, 19, whatever, you get a job later, you straighten your teeth, that's fine. And then just remember that your traditional braces and your Invisalign is not going to be pulling and maintaining that forward position that we want. So you have to be careful. Everybody's there's also this huge phase or this huge craze about Invisalign, and I do use it in some patients. I think it does have a place, but when you're dealing with somebody that's got TMJ issues or you're dealing with somebody that's got a lot of breathing issues, I'm not too keen on using Invisalign. If we need more of that forward growth, that forward remodeling, we really have to use controlled arch braces. And unfortunately, that means that we got metal brackets and you're going to be in wires. And that's the only way that I know clinically how to do it.
It's a wealth of knowledge, and it's a different take on things. I would say it's functional faces, and maybe braces.
It's a good tag, Lily.
Yeah, and I think it's about, looking at the teeth, not just isolated, and we're going to look at the whole picture.
Yeah,
so thank you so much.
So if you are a parent listening to this, if you have kids that you think need braces, if you need braces, if you have a toddler who's snoring or have their mouth open, please come in. This is what we do at Orthodontics. We're very passionate, as you can tell, and there's lots of resources on our website. So please follow us on social media, Orthodontics. We have Facebook, we have Instagram, we've got TikTok. Follow us on social media, leave us a review, and if you want to do a consult, we're happy to do virtual consultations. We also can see you in person if you're in the Seattle area. So anyways, thank you, Lily, so much for being on the show.
You're welcome.
And I'm so happy that we did this podcast. Remember, everybody, that your mouth matters.